right. Good afternoon, everyone, and welcome to another podcast for the DEI Council. We're going to have a little discussion and education touching on aspects of Black History Month, Women's History Month, and some religious things that we should know about. Specifically, we're going to be talking about Ramadan in this session. And today, I just want to introduce our guests briefly and have them tell us a little bit about themselves. First, I'm going to start with Dr. Downer. I know you're a family medicine resident in your third year and actually the chief resident. And also, we have Dr. Henderson, who's an emergency medicine resident in her second year, and we have Dr. Hendricks, who is a psychology resident in her second year. But first, we'll start with Dr. Downer. Tell us a little bit about yourself.
Hey, I'm Dr. Carice Downer, family medicine, PGY3. So I'm coming towards the end of my time here at NGHS within the residency program. Originally from a Caribbean background, my family is Jamaican. So, Black History Month, Women's History is very important to me. And I feel like NGHS is very good at embracing our cultural diversity here.
So I'm Hawa Henderson. I am a PGY2 emergency medicine resident here. I'm originally from Knoxville, Tennessee, born and raised, but ethnically, my dad is African American and my mother is Sudanese, actually. But I grew up in Knoxville my whole life, went to the University of Tennessee, did med school at Kansas City University in Missouri, and then here I am now.
All right. Awesome.
All righty. My name is Amanda Hendricks. I am a PGY2 psychiatry resident, and I'm originally from Atlanta. I grew up in Southwest Atlanta, kind of near the airport. And I identify as a Black American. So I am a descendant of American chattel slavery. And I think it's important for us to also highlight the diverse background of African Americans. And I went to medical school in Arkansas, a little town about an hour west of Memphis. So I did my clinical rotations in Memphis, which was a great experience. And I'm excited to be back in Georgia for residency. It's been great so far.
All right. Awesome. Well, thank you for that. Thanks for sharing. And I do want to expand a little bit and just give some brief information about what drew you to medicine in the first place, and specifically the area that you're in, since we have a variety here.
So for me, it really stemmed from my background. Jamaica is a third world country and our healthcare system can use a lot of help. And as a child growing up, seeing what was happening in the hospital systems and stuff like that, it made me want to do something about it. Since I was about 11 years old, I was sure I wanted to be a doctor. And I think NGHS, the reason I chose here was because they have a very diverse population that we treat. At any given time, I can be treating someone from anywhere in the world in this hospital system. And I feel like it's important for me to give back to lower socioeconomic communities. And I feel like Gainesville in itself gives me that well-rounded picture that I really wanted to give back towards medicine.
Okay, awesome. Dr. Henderson?
For me, similar story. I've always known that I wanted to be a doctor. I think maybe since I was about 10 years old. I did think I was going to be an OBGYN, but didn't work out that way. But growing up and seeing how my mom tried to help our family overseas back in Sudan, it was very touching for me. And that always felt like a motivation that one day I'd be able to go back and help in some way, which is even more relevant now considering there's currently a war going on there. So that was always my motivation, always through med school. That was always my why. And when it came to emergency medicine, I felt like it's honestly, being a doctor is probably one of the most valuable things you could ever do. You can help someone pretty much in any situation. And I felt like emergency medicine helped me to do that the best. I love procedures and I love working with other people. I like talking to patients and figuring out what the story is initially, which is something exciting for me. But I think why I chose Northeast Georgia is when I came here as a med student rotating, it just felt like the people here really like their jobs. Like they really like working together. They like providing good care for their patients. And also the patients are very grateful, if that makes sense. Like I like working in a little bit, I know this is not technically fully rural, but it's more of a community hospital. It's not like as necessary an urban setting. And I feel like getting that patient population where they really do need your care, need your help is gratifying.
Thank you.
All right. So for me, a couple of things comes to mind. And I say this to highlight the importance of representation. But a big part of me going into medicine was seeing my dad. He's a doctor. So seeing him as a Black man in medicine, and he went to Meharry, so seeing his, cohorts and having that representation to see that it's possible, I think is so important, especially for kids. It's hard to imagine something that you can do if you don't see it for yourself, and seeing someone who looks like you is super important. Psychiatry, however, I thought I wanted to do pediatrics when I first started medical school, but I spent some time as a teacher between undergrad and medical school, and I really loved it. I thought about staying in education because I loved it so much. But during my clerkship, I saw the differences between pediatrics and like child psychiatry, and being able to work with kids who have like ADHD and learning disorders. I was like, okay, this is kind of familiar to what I was doing before. So I was like, okay, I think I'm going to do psychiatry. So that's kind of what led me down my path.
Okay, awesome. Yeah. Thank you all for sharing. You touched on something there, and you said representation. And one of the things that we know is that patients tend to adhere to the treatment plan, adhere to follow-up recommendations when their physician is someone that looks like them. So I think that definitely is important. Just wondering, for you, did you have that when you were on your journey in medicine? Did you have some representation? Did you have people you could look to and that help you?
As a young child, I think once we left Jamaica, I really didn't have very much representation other than one, I think, provider that looks like me as a child. And I saw her more towards my teenage years when I had already decided that I wanted to be a medical doctor. But she was someone that definitely I kept in mind over those years, because she was someone that I'm like, okay, well, she did it and she's in this field and I can do it too. But I don't think I really had that much growing up that I would have loved to see a bit more. I feel like now that I've come to this point, and I do have certain role models here within this hospital system, it has given me a lot more seeing them in certain leadership positions and things like that to make me be like, okay, yes, this is something that we can do and I do belong here.
Okay, awesome.
For me, honestly, growing up in Knoxville, Tennessee, and then just being the first person in my family to go to college, I didn't really have much representation at all. It wasn't until kind of like I was, I think, post-undergrad, there was a doctor that moved to the community, actually a Sudanese woman, and she befriended my mom, and then I was able to shadow her at the hospital, which again kind of reinforces this idea that in medicine, especially medical education, there's so much social capital that's involved that a lot of times, if you're not from an affluent background, if you're not someone who has that representation, then it's difficult to kind of get your foot in the door. And again, highlighting how important representation is to even get a little bit into trying to get into medicine or trying to get in med school. And I think that's another reason why I chose Northeast Georgia, because Georgia is such a diverse state, and especially this area being so close to the city, but then also a little bit in the suburbs and like rural areas. You do see a very diverse patient population, and being here has been one of the first times I've had physicians in a field that I'm interested in who look like me, to be honest.
Wow. Thanks for sharing again. So it sounds like there are some opportunities. Do you have any thoughts about how we can improve upon that, so where when you're younger, you have chances to see people in healthcare that can be a role model or someone that you can look towards to help?
Yeah, I think, it starts young, and I think that's why it's so important to have, pediatricians that look like the communities that they're serving, and psychiatrists and family medicine doctors and surgeons and emergency medicine physicians, because doctors are at the core of society and taking care of different communities. And when you have people from those different backgrounds as well, it helps to kind of keep that ball rolling where you're able to inspire the people around you and provide that mentorship too. And one of the things, like Howell was saying, that I love about Northeast Georgia is that the faculty is so diverse. And I feel like residents from all different backgrounds are very supported here. And you can definitely see that there is intention behind diversity, I would say. Yeah.
All right, good. And as the next leaders, what thoughts do you have of things that you might do in terms of helping with representation?
I think for me, it's important to give back. So I know that when I was considering going down my journey of medicine, it was very hard for me to find a mentor that looked like me, that was willing to take a student on, or just before I even became a doctor or a student, just a pre-med that was just interested in it. I think it was very hard for me to find someone that would allow me to shadow them and understand what it was, because no one in my family had become a medical doctor in this country, at least. So I didn't know what that looks like. So I think it's important for me to give back to the community. And if there are young people that look like me that would like to shadow a doctor, I think I should give back in those ways. Community events. I mean, if we show our presence in the community, these people are more likely to listen to us. And sometimes they may not see you in the office, but they see you at these community events. You're leading these things, you're making these changes. And some little girl or little boy somewhere looks up to you and you don't even realize it. So I think making your presence known in the community and being available is my way that I should give back.
Good. Awesome.
Yeah, I would just echo that, just mentorship. This is a good start, just this, and then putting it out there for other people to see, because I think it does start really young. Like, I remember very detailed conversations I'd have with my teachers who didn't look like me, and I would express that I wanted to be a doctor, and it wasn't necessarily encouraged, and then you grow up and you start figuring out, where can I shadow, who can I talk to, and you see that it's mostly people who are getting like their family friends that they're shadowing. You don't have that. So I think it's about putting yourself out there, making sure that you're available. There is a mentorship program here at the hospital with GME, where pre-meds, like not even medical students, pre-medical, I think high schoolers, and I think undergrad can come and shadow different specialties and see if they're interested in it. And that's a great start. So I never had anything like that.
Yeah, well, thanks for sharing. Yeah, I think definitely those things are great. I think something like this podcast can be very beneficial to be like outreach, to let people know about what things are happening and the type of folks that are here at Northeast Georgia. And so hopefully things like this will be really helpful in fostering that representation.